Professional voice users are people who require significant voice use for their profession. They may be at an increased risk of developing voice problems due to the vocal demands of their jobs. Professions include singers, actors, teachers and professors, attorneys, physicians, clergy, telemarketers, customer service representatives, salespeople, and many more. For professional voice users, voice injuries or disorders can result in temporary loss of income, loss of employment, as well as increased emotional stress and anxiety.
The Mayo Clinic Florida voice team includes Dr. Amy Rutt, a fellowship-trained laryngologist, and two speech pathologists who are singing voice specialists. Together, we use our unique abilities to understand the urgency of your voice problem and to help you through your vocal recovery as efficiently and effectively as possible. Our team has extensive experience not only in the evaluation and treatment of professional voice, but also in general voice disorders, breathing disorders, and swallowing disorders. You should consider seeing the voice team if you experience hoarseness or a change in vocal quality or loudness, increased vocal fatigue, breathiness, loss of singing range, tickling or choking sensation, or throat pain.
At your appointment, we will take a detailed history of your voice problem, including when it began and how long it has lasted. You'll be given the opportunity to relate details about how your voice has changed and about how this is impacting your work and daily life. If you are a singer or actor, we will also assess your singing range and vocal demands of various acting roles to better guide the treatment and therapy process. To assess vocal fold movement, a video stroboscopic exam will be performed, during which a camera called an endoscope that can visualize the larynx will be used to assess vocal fold vibration and movement.
When assessing a voice problem, the speech pathology singing voice specialist observes posture, breathing pattern, and speaking voice habits. For singers, the speech pathologist will ask the singer to sing a few measures of something that seems challenging. We will also ask questions pertaining to their particular voice use patterns, environments in which they use their voice, and singing background. And then, after getting a good overview of the singer's needs and the current vocal fold status, the physician, the speech pathology voice specialist, and the patient can discuss the best treatment plan.
An evaluation at Mayo Clinic Voice Center includes video stroboscopy. This test uses a camera called an endoscope that can visualize your larynx. There are two types of endoscopies, flexible endoscope and rigid. A flexible endoscope is a small flexible camera that looks through your nose and hangs over the back of your throat to view your larynx. It does not hurt and only takes 1 or 2 minutes to perform the test. A rigid endoscope is slightly larger but still small, firm camera that enters your mouth just to the back of your tongue and looks at the larynx via the mouth. It does not go down your throat and also does not hurt. Both endoscopes use light. The light source is a strobe light that allows the physician and speech pathologist to view the vocal folds vibrating in slow motion.
Aside from stroboscopic examination, you can expect the following at your Mayo voice team evaluation: acoustic and aerodynamic measures of voicing. These measures are taken using equipment that measures the overall function of your voice: loudness, pitch range, habitual speaking pitch, vocal quality, and your ability to sustain certain sounds. A general ear, nose, and throat exam, during which the physician will look in your ears, nose, and mouth for any abnormalities. Education regarding your diagnosis and the need for possible additional testing. Once a diagnosis is made by the physician and the voice pathologist will explain your diagnosis and your options for treatment. These may include voice therapy or surgical interventions. Finally, a trial of voice therapy techniques will be completed to assess if you are a good candidate for voice therapy.